Hello, and thank you for joining us tonight on the 11th hour, navigating through the end of life. I'm Curleen Leonard, and tonight's topic, we're going to cover the most profound question that everyone wants to know. Who pays for the hospice care services? I hope you're ready. Grab your pen and a notebook. Let's begin this conversation, but keep in mind the information shared on this YouTube channel is for educational purposes. So please verify all information with your local hospice provider. Thank you. All right, so tonight we're going to discuss who pays for the hospice care services. And to make sure that all information that's being provided to you is covered, I do have my printed um, page or two because there's quite a bit to get through. I will try to keep it brief and cover the most essential information that you need in order for you to be more informed. So, to begin, when it comes to who pays for hospice care services, Medicare is by far one of the main payers or payer source for hospice care services. Majority of individuals do qualify for Medicare. Bear in mind, Medicare is for anyone 65 um, and older, or those with serious health issues or disabilities, like kidney disease, and those who have disabilities. But primarily, Medicare is for those who are 65 years old or older. Right? When it comes to hospice care services, uh, majority of the individuals within that age bracket do qualify for Medicare because they already have Medicare. Hopefully, they've already signed up for Medicare. So, when it comes to hospice, if that individual has gotten a diagnosis, a terminal diagnosis, to become a hospice recipient, that Medicare is already in place. So then it's just a matter of getting it covered, hospice covered. And if the individual has been admitted to hospice, therefore a medical doctor deemed it um, reasonable and appropriate for the individual to come on services. So Medicare would provide, would be the payment source for that individual. The other thing about Medicare that I want to cover is Medicare does pay for hospice if the individual is qualified. But there's something that you may not be aware, or even if you're currently on hospice services, that you may not be aware. Medicare does not pay for um, room and board. Excuse me. They do not cover room and board. They pay for the medical part of the hospice services, the nursing care, the staff that are coming there, the medical equipment from hospice are covered under the Medicare plan. Now, if you are in a nursing home or assisted living facility, then you have to figure out how are you going to pay for room and board. And that is something you can discuss with the business office or the person they have responsible to assist the family. It may be a social worker who works at the facility, or perhaps the business office, or they may have someone assigned specifically to deal with um, payment or coverage. All right, so make sure you double check and figure out who would be responsible for the room and board if you are at a facility, mind you. A nursing home, assisted living facility, hospitals too. That's a question you may have to work out and figure out I would say beforehand. If not, then this is the right time to ask those questions. Next on the list would be your Medicaid. Now, again, Medicaid is for those who cannot afford um, basic needs and who needs assistance from the government. Again, you have to qualify for the Medicaid provisions for hospice services. Not only just the hospice services, bear in mind, if you go to a facility, your room and board has to be covered. But if you qualify for Medicaid, Medicaid will generally cover the room and board as well as your hospice services. That's if you qualify. There are criteria that you have to meet to qualify for Medicaid. And if you do not, then there's, again, other procedures that have to be put in place to get to see how to get you qualified. And if you're unable to meet those criteria, then the best thing to do is to meet with your social worker or your hospice provider to discuss a plan of how these services will be paid for in terms of room and board. Now, bear in mind what I said, hospice is usually paid by Medicare. And if the person does not qualify for Medicare but qualifies for Medicaid, Medicaid will pay for the hospice services. I want to throw this in there. You have facilities that do have Medicaid beds. So if you're qualified for the Medicaid, it's possible that you will get a bed at a nursing home. If you're a nursing home recipient, or if you qualify to be placed at a nursing home. Now, if you're home and you're a private home, really, the only thing you have to worry about is receiving the hospice care, which is covered, again, through either Medicare or Medicaid. I have not covered the next plan, but those two will cover the services from hospice care. And the services include the hospice team that will come to your private residence or the facility where you are located. Okay, and they will come and bring you all the services, including equipment. We'll touch base on the equipment a little later on, but equipments are covered through hospice care services as well. The other plan, the veterans benefits. Our veterans also can qualify for hospice services through the VA. Now, that's a little more complicated. It is best at this point for you to meet with a VA specialist, or you could simply give them a call and find out how does one become qualified, or do I qualify for the VA benefits. One thing I will say, and again, please double check with your local provider. So the information I'm providing is for educational purposes. I want you to also reach out and get relevant information from your local sources. Going back to the veteran benefits, the VA will always want you to register first. You have to register with the VA in order for them to have the necessary information on you to qualify you for any services, really. So one primary step I recall was first have the assessment that they want to assess the veteran first, obtain the information, and then speed up the process. Okay, if you are a hospice recipient, the VA will do all that they can to ensure that they expedite the process to try to get you those benefits. On the point of VA, the VA also has its own private facilities for hospice patients. So apart from being in your private home, a nursing home, an assisted living facility, if you qualify, you could also gain access into a VA facility that specializes only, or that's there only for their veterans. And I hope it works out for, if you're a veteran, you're watching this, yes, look into it. If you feel like you would much rather go into a facility, see if you qualify for one of the veteran beds at a veteran facility. All right. The last one pertains to private insurance. Now, if you do not qualify for Medicare or Medicaid, there's also private insurance that will pay for hospice care. With the private insurance, you have to get in touch with your provider to ask questions about your deductible and how they will cover the fees that are associated with hospice. And what must you do on your end? What documents do you have to provide to your provider, your private insurance, in order for them to expedite the process to get you going for hospice coverage? Now, let me step back a bit. There, within hospice, your local hospice service providers, there are individuals who are there to assist you in the process of getting coverage through your insurance company. Or if you are a Medicare recipient, again, the hospice has staff, billing departments, insurance department, the social worker, specialists with those who specialize with Medicaid. I worked with a lady who specialized only in the Medicaid aspect. So she was always available to answer any question that we had and to help with the application process for those who needed to qualify for Medicaid. So keep that in mind, that hospice has individuals ready to assist you, to help you, because this is a crucial time in someone's life. It is an emotional time. And the last thing that you want to deal with is the hassle of getting insurance or coverage for the care, compassionate care that you need. So again, the private insurance, get in touch with your provider, ask the relevant questions when it comes to coverage for hospice and what is not covered. Rather than asking what's covered, I think it's even more important to find out what's not covered. Keep in mind, as I stated, with Medicare, hospice is covered, but who pays for room and board? That has to be worked out. You have to figure that out, and you have to speak with the individuals in charge to find out, okay, who's going to cover the bed. Okay, keep that in mind. Another point that I want to bring up is the your benefit periods. Within hospice, there are two 90-day periods that you have to transition through. So you have to remember, hospice is 6 months or less. So you have two 90-day periods initially, and after those two 90-day periods, then you enter into your 60-day qualification periods. The 60 days are really unlimited. And why do I say that? As long as you continue to qualify or to meet the criteria to remain on hospice, even if you exceed the 6 months, as long as you continue to meet criteria, you get another 60-day benefit period. All right. And if you have a nurse practitioner within your hospice team or the medical doctor, they will be the one to do the face-to-face recertification to see whether the individual still meets criteria to remain on hospice. Now, we're not going to discuss the discharge process in this episode. That would be for a separate taping. We're simply talking about payment. Okay, so if you continue to meet criteria to remain on hospice services, it will continue to go 60 days each. So you have 290 days, and after the 290-day periods, then you enter your 60-day periods. And I cannot give you a time frame, only that you have 60 days. If you get to the end of that 60 days and you qualify for the next 60 days, then you remain on services. All right. Now, just reviewing, I want to go back again to Medicare, make sure I covered as many relevant information for you as I could possibly gather without spending too much time on just one particular payment source. Now, Medicare, as we stated, you have to qualify, is primarily for people 65 years or older, okay, and individuals with certain disabilities. Private insurance now, but the private insurance nowadays, we have individuals with long-term care plans. Let me tell you, it's an asset to have. It really pays off to have long-term care insurance. But bear in mind, hospice is not a long-term care. Hospice is 6 months or less, so it does not fall in the category of long-term care provisions. But even then, there is the provision now within your long-term care plan. Perhaps there was a language in there, a provision that would provide additional payment or support if one becomes a recipient of hospice care services. So you may want to reach out to your long-term care plan provider to see if hospice qualifies under your plan. And if you're thinking about getting long-term care plan, that may be a question to ask the provider. Can I have that inserted in my plan, or does my plan cover? You may want to ask that question. Does my plan cover hospice services should I require it later on in life? All right, that's a bonus for anyone who's watching. Long-term care plans do work, and it is beneficial to have long-term care plan. They also assist with private caregivers. We'll talk about that on a different episode, but since it came up, I wanted to mention that. What else do I want to I'm thinking of a family that I had a very great question for me while I was providing services as a hospice social worker. And it was about the long-term care plan. And with the long-term care, they were able to have hospice services within the home, not a facility, and they were able to double up on the services. Not only were they able to get, because of the diagnosis of 6 months or less, the company was understanding and willing to assist in any manner possible. So that individual received the permission to go ahead and use their long-term care plan to pay for hospice care services. At the same time, they were able to get additional hours for a private caregiver to come in and help out. Isn't that wonderful? So check your long-term care policy and see what the language, review it, And if you don't understand, or you need additional information, reach out to your provider. That's what you pay the money for. Find out what they cover. Find out, uh, if something happens and I need caregivers, will the policy cover it? If I need hospice care, will this policy cover it? Okay, that's that's why you have the insurance. Um, I just wanted to mention that to you. Also, the Veterans Affair, there's a lot of services available for hospice recipients who qualify for the VA benefits. And also the private caregiver, the VA can also assist in giving additional caregiver support. It all depends where you're located when it comes to the VA. Find out more by reaching out to your VA representative. And if you're not familiar with them, get familiar with your VA. If you are a veteran, you deserve the services. You gave so much to this great country. Reach out to the VA and find out, at this point, what do I qualify for and what comes with the services as a veteran. And can I utilize the benefits within the home, a facility? Which facility will accept the VA benefits, which will not? There are nursing homes who have VA beds specifically for a veteran. There are some who do not. And bear in mind, I did mention the VA has its own personal facilities. So you have choices. That's my point to you, is that you have choices. With Medicaid, now we're back to Medicaid. So Medicaid is a little more trickier than all the other insurance providers. And the reason why I said that, number one, you have to provide quite a bit of documentation in order to qualify for Medicaid. Okay. Don't forget, they go by your income. Okay, you have to meet, and if you exceed what is allowed with Medicaid, you may not qualify, or they may ask you to spend down the amount. This is a great time to reach out to your social worker and ask for assistance in this matter when it comes to Medicaid. I've depleted most of my funds. You may begin that conversation, and now I'm considering applying for Medicaid. Would you mind assisting me with the application or the process of getting Medicaid? All right. A lot of people start out within their private home, but then things transition. Either the illness progresses to the point where the home is not the best place for the individual, and it makes more sense to go to a facility like a nursing home or assisted facility. So now there's a change. You have to start wondering, well, who's going to pay for the assisted living care, right? Bear in mind, the insurance is paying for hospice services, not for the bed, okay, or the food that's being provided to individuals who reside within a facility. So now the planning comes about who's going to pay what in terms of room and board. When it comes to your care that's related to your health, that is covered again by Medicare, if you qualified for Medicare, by Medicaid, if you qualify for Medicaid, by your private insurance, or by the VA. All right. That brings up another great question. A family asked me multiple times. I was asked this question, but I remember a scenario where a family had Medicare part, Medigap, the Medigap. It's a supplemental insurance. And the question was, Perlene, should I cancel that my supplemental insurance now that I'm on hospice care? And my answer to that person was, actually it's two parts, but the first initial one was no. After I've asked many questions, the answer was no. I think it's best for you to hold on to your Medicare supplemental insurance or Medigap. And the reason why I would advise an individual to maintain the Medicare or supplemental insurance, any supplemental insurance that you have, is simply because there are prescription drugs that hospice will pay for. Those are formulary prescriptions that hospice is responsible for, relevant to your care and to the diagnosis, your primary diagnosis. But there are some prescriptions where you, the individual, may feel like, I still want to take it, but hospice cannot cover it because it does not relate to your primary diagnosis with hospice. On that point, that's a conversation you will have with your hospice provider, and they will let you know, we do not cover this particular medication. Do you still want to take it? Or we don't see a reason for you to continue to take this medication, but the decision is really always up to you, and that's where your Medigap insurance will come into play. Just some takeaways before I end with you tonight. So your primary payers for for hospice care are number one, Medicare, Medicaid number two, number three would be your private insurance, and then we have the VA for those who qualify for VA benefits, right? And on Medicaid, Medicaid does not has no bearing on age. Medicaid simply means you have to qualify based on income and need. With anyone who is on hospice services, I've typically seen where they try to expedite the process just to get things moving on a faster pace, to get those services out to the individual who is facing a terminal diagnosis and who has a life expectancy of 6 months or less. So they do try to expedite that process. All right. Finally, we're in on the note that no matter what the situation is, the services that you are receiving from hospice care, there's so much that you're getting for what's being paid, right? The hospice facility, not all hospice have a hospice facility, but some do. If you are sent to the hospice facility, that is covered through Medicare and Medicaid, depending on the situation that's going on, or your private insurance. Now, you may want to speak with the individuals at the hospice facility to see if there's anything that you're responsible for beforehand. Okay, before all is said and done, find out, speak with your hospice representatives. They know your case, they know your peer source. If you're concerned about anything, please reach out and talk to them. And as we've always said on hospice, you don't owe us anything. Majority of the time we come to the home, and one of the major concerns is, how much is this going to cost me? Well, number one, you're home, and hospice care comes to you. Everything has already been verified through Medicare or your insurance company. All right. If there was anything that you were responsible for, trust me, hospice will reach out to you to discuss it and to find a way to make it work, because our primary focus is comfort for you, the individual receiving hospice services. The additional in-depth information, please reach out to your hospice provider, speak with your social worker assigned to you, or give your Medicare your private insurance or Medicaid representative a call to get additional information. Thank you.